Hi, ma'am.
Hi, ma'am. Good.
Am I audible, ma'am?
Yes, ma'am, you are.
Okay. So your volume is very low, or maybe my mic is speaker is.
And I can try increasing mine. Actually, there was a small error in the invite. I made it like Zoom invite. I copy pasted, but I have given 3:30 p.m. to log in because then only Zoom will admit us. No.
Oh, okay.
So people have started messaging by 3:30 itself.
Yeah, because even the link was showing here 3:30.
Yes. Is my volume okay now?
Yeah, ma'am.
Yes, ma'am. Sharon Chechi, are you there?
Yeah, Sharon is there, I think.
Okay.
Hi, Sharon.
Sharon Chechi is the president of our Community Nutrition Forum. Other three office bearers are not available today.
Mhm.
We're getting in people
Hi,
joining.
good evening. Good evening, Sri.
Hi, Sharon. How are you?
Yeah, hi. Actually, I have some guests at home, so anyway, I'll attend.
Anyway, I think you're having a recording of the program, so
Yeah,
you
yeah,
can share it in YouTube later on or however you want to.
yeah. Okay. Today is Easter day, no? So,
I was wondering why you planned it on Easter Day.
Basically, we plan on third week, no, every month. So I told you third Sunday. Then at last moment only we noticed it as a Easter.
So many people in Kerala will be celebrating Easter in the church. So I really wonder if they will be attending.
Yeah. That's why we also plan for recording. Commonly we do in the Gmeet also. Gmeet we don't get recording, no? That's why we had this recording also. Just 2 minutes.
Sure, sure. Can you give me a little balm?
Ma'am, by 4-5 we'll start, ma'am, because people are joining in.
Surely, ma'am.
Teji, shall we start?
Yes, please. Yeah.
Very good evening, everyone. Many of you might have been knowing about Community Nutrition Forum. Community Nutrition Forum is a forum initiated during the Corona phase. Especially, we focus on educating the general public, food education, because already Kerala is a capital of most of the non-communicable diseases, but our food patterns are getting drastically changed under the influence of Arabian foods and other different regional foods also influencing. And HFSS is very high in our Kerala community. Even a normal homemade sweet preparations for the evening snacks is also having a high level of HFSS foods. So we initiated this with the intention to educate the general public, and we have done several programs during Corona, and even now we are continuing our food education sessions for the public. We have closed more than 10,000 events in we initiated in 2021, and we got it registered under Indian NGO category in 2023. And we have crossed more than 10,000 programs, and we have few programs for our community also, that is dietitians fraternity. And in this, we always focus on empowering ourselves. So every month we have something called Dietopedia, which is nothing but our regular clinical nutrition update. And we have something called Researchopedia, which is a journal for the researchers who is passionate in nutritional research. So today we have a Dietopedia, that is a continuous nutritional education from our dear Meenakshi Bajaj ma'am. So Meenakshi Bajaj ma'am doesn't need much of the addressing and all, but still we have to give her a formal addressing. We sincerely welcome you, ma'am, and all the participants. I welcome you for today's session. So about Dr. Meenakshi Bajaj, she is a registered dietitian with 29 years of experience in clinical and therapeutic nutrition. She is working for Tamil Nadu Government Hospital, Tamil Nadu Government Multi-Super Specialty Hospital in Chennai. She is a certified bariatric and critical care nutritionist, certified diabetes educator, and nutrigenomics consultant. She also had done ESPEN LLL certified in renal, onco, obesity, diabetes, metabolic, and whatnot. So many things, pulmonary, pancreatic, liver disease. She is a state rank holder and best outgoing student in her UG days. She is also the convener for Chennai chapter NetPrefen, National Executive Committee member in IDA, treasurer of Association of Diabetes Educators India, and former president of IDA Chennai chapter, former executive committee member of NSI Chennai chapter, and she has organized several national and international continuing nutritional education programs and workshops. She is author of Diet Metrics, Handbooks of Food Exchange, and one more on this pregnancy, GDM also. I have both the books with me. And she has also received Best Nutritionist 2019 award from Pitup Fest 2019 and Sadhana Award in 2020 for contribution in the therapeutic nutrition, and Ayyappan Quality Award of 2021 clinical and therapeutic nutrition and FSM. She had also developed a COVID menu in March 2020 for TN state government medical institutions. So this is about her, and I welcome all the participants for today's interesting. For this month is for IBS Awareness Month, and for this we have dealing with gut health. Please be attentive and enjoy your session. Ma'am, we welcome you for this wonderful session, and over to you, ma'am.
Thank you so much. Give me a moment. I will just share my screen. Is my screen visible, madam?
Yes.
At the outset, I'm truly grateful to the Community Nutrition Forum, to Dr. Sharon Thomas, Dr. Shri Priya Shaji ma'am, and our entire team for giving me the opportunity to be talking to you on a topic which is very close to my heart, which is gut health and nutrition. So when we talk of gut, we always think of that the gut can only transport the food, it can help in digestion and absorption. there's something beyond that also. Beyond that means what? One is immunity. It is otherwise known as the second brain. It's interesting to know that gut is also known as the largest immune organ, and also it is the second brain. Apart from that, what are the other functions of when I say a healthy gut is to, improve your immunity is obviously what I've made a mention of. Also to reduce tumorogenic properties and also help in the synthesis of certain B vitamins like vitamin B12, B6, and also importantly, vitamin K. You'll be wondering why I'm making a mention of this. That is in the vegetarian population also, you find that they are not having nil vitamin B12. So some amount of B12 does come from milk, but a large chunk also comes from synthesis in the gut. Now, when we talk of gut health, there are several factors which have an influence on gut health. There are certain non-modifiable factors like the genes. The gene of an individual cannot be modified. The maternal age at which she has done the delivery cannot be modified. Now, whether she had a C-section or a vaginal delivery is not in our hands. To some extent, it's not in our hands. So these are the certain non-modifiable factors. Certain modifiable factors are those is exposure to drugs, alcohol, and as ma'am was making a mention that Kerala seems to be consuming a lot of HFSS, a lot of ultra processed foods, that is in our hands. Apart from that, if the child has been bottle fed or breastfed, is in our hands unless and until there is a small component of lactation failure. So many factors have an influence on our gut health, leading to gut dysbiosis or gut eubiosis. So as I made a mention to you, an important part of gut is digestion. Then comes is modulating the immune responses as well as tumorigenesis and also synthesizing vitamin B12, folate, thiamine, and vitamin K. This is a very busy slide, but a very simple message from this slide is, as each coin has two sides, similarly, when we talk of gut health, we have the microorganisms which can do good to our health as well as bad to our health. In short, if I'm to say, our gut health is a mother of non-communicable diseases. So if our gut is unhealthy, you can expect cardiovascular complications because of promotion of angiogenesis, because of lipogenesis. And on the other hand, if we are going to have a healthy gut with good bacteria, we can definitely improve the nervous system, not only the nervous system, anxiety, stress, depression, prevention of chronic inflammation. In turn, when there is a prevention of chronic inflammation, you're reducing insulin resistance, improving insulin sensitivity, end of the day, improving metabolic health. So this is yet another busy slide, but it's a very, very important slide. You know why gut health is important and what gut dysbiosis does to an individual or to the host health. So everybody is aware of the term gut-brain axis. It's not a new word for any one of us, but it's interesting to note that not only gut-brain axis, like as ma'am was making a mention that this month is a month of IBS awareness. Whenever one has to attend an interview or say, going for an important meeting, or even nowadays children who are very anxious and very disturbed, it actually leads to irritable bowel syndrome, diarrhea. So they have several episodes of diarrhea just before they are entering the examination hall, or they're attending an interview or a very high profile meeting, whatever, maybe something very important which is stressing them, leads to IBS-D. Now, that also is associated with gut health. So stress, anxiety, depression, schizophrenia, autism, all of them are directly related to gut health. In fact, I had the opportunity to be trained in for irritable bowel syndrome, low FODMAP diet by the Monash University, wherein we did read that when somebody is just having therapy, it could be just music, it could be alternate therapies which de-stresses our mind. It definitely helps to improve symptoms of IBS equivalent to that of medications. So why do we talk of medications? We talk of correcting our gut. And when our gut is corrected, we definitely improve on anxiety, stress, and depression. Now, there are certain microorganisms known as psychobiotics, which help in turn improve the production, stimulate the production or the release of dopamine, serotonin, cortisol. All of them revolve around anxiety, behavior, depression, stress. All of this is associated with gut health. And there is an important terminology known as the psychobiotics, which help to improve all these symptoms. Now, as I mentioned to you, there are several other organs which are related to gut health. Now, if your gut is dysbiosed, you can expect atherosclerosis. And unfortunately, we've been seeing a lot of thrombotic events even in the younger population today. And it's a direct correlation with the younger population when I say it's their exposure to junk foods, or basically when I say junk eating, I'm talking of saturated fat, trans fats, insecticides, pesticides, also preservatives. Then comes with the lung. So I think that the most time tested example which I would give would be COVID-19. In COVID-19, a lot of patients were lost to mortality because of being persons with diabetes or with CBD. They were the ones who were lost to life. Unfortunately, the reason being they had, when their blood sugars were not under good control for a long period of time, very high HbA1c, poor glycemic control or glycemic variability, they were having gut dysbiosis, which led to a cytokine storm, opportunistic infections like pneumonia, COVID pneumonia, AKI, sepsis, and mortality. So that is the direct relationship with gut health. And all of them during those days, I think pandemic was the time where several entrepreneurs mushroomed. They started producing turmeric and tulsi bread. Everybody wanted to develop immunity overnight. Similarly, like how you cannot develop immunity overnight, you cannot develop gut eubiosis overnight. It is a long-term process. Now, when it comes to the liver, you can expect the non-alcoholic fatty liver disease, which is not anymore called as non-alcoholic fatty liver disease. It is called as metabolic dysfunction fatty liver disease. Then we have the pancreas, where there is insulin resistance, diabetes, PCOS, osteoporosis, frailty, sarcopenia. Then also an important component, we've seen a lot of psoriasis patients who don't find any relief to psoriasis in spite of being on a lot of medications. Acne is another important issue which our younger population goes through. This is hormonal, I do agree. But apart from being hormonal, gut dysbiosis plays a very, very important role with reference to acne and psoriasis. Last but not the least is acute kidney injury, nephrolithiasis, CKD. So there is an important message that when we try and improve our gut health, we prevent the progression of chronic kidney disease. So in early stages of nephropathy, if we put the patient on probiotic and prebiotics, they do improve by preventing the progression from nephropathy stage 1 to stage 2 and stage 2 to 3 and onwards. Last but not the least is the gut bladder axis, which means overactive or painful bladder or urinary tract infection. So the entire host's health depends on gut health. Now, this is yet another slide which tells us something very, very beautiful. Tells us how does the gut talk to the brain. It either talks to a neural pathway, that is through the vagus and the enteric nervous system, similar to a phone call. We just pick up the call and speed dial number 6 or 7 and we get connected to the other individual. Second is the endocrine pathway, which is like an email, which takes more than about 2 to 3 minutes to get dropped to the opposite person's email ID. The third is the immune pathway. And last but not the least is the microbial metabolites, which play a very, very important role, not only on gut health, on inflammation, on also on mental health. As I made a mention to you previously itself, recent research indicates that gut functions as a second brain, releasing mood regulating chemicals like neurotransmitters like serotonin, dopamine, GABA, aminobutyric acid, which play an important role with reference to mental health. This was yet another interesting slide which I recently, came across. I was part of another program, which was a state planning commission program, wherein they wanted to discuss on malnutrition, basically undernutrition in the pediatric population, where this particular paper on by WHO 2021 as well as Hill et al. In 2017 did make a mention that a healthy gut microbiome supports digestion, nutrition, absorption, and mental health, which in turn, if it is not addressed in time, would lead to malnutrition, infection, and allergies in children. So we don't only always discuss gut health with reference to the adults, IBS, but also with reference to children. And we do understand that breastfeeding is the first, introduction to best gut health. We don't have an immunometer to tell us how well is our immunity. So that is why, as I made a mention to you, that a lot of patients we lost in COVID-19, not only in COVID-19, in the ICU, with reference to sepsis, multiple organ failure, when they have poor gut health. Now, how do we sort out our gut health? Obviously, there are two best ways to do it. One is going either animal-based or plant-based. It's the plant-based diet which helps to improve gut health, majorly in comparison to animal-based diet. So whether we talk of CVD, CKD, hepatic diseases, colorectal cancer, diverticular diseases, then celiac disease or Parkinson's, all of them come in the ambit of animal-based diet. Now, where it's a very, very intriguing question. Everybody still has yet to get an answer whether the egg came first or the chick. So with reference to gut dysbiosis, what sets in first? It's the chronic inflammation and gut dysbiosis which sets in first, which stands a base for insulin resistance, which in turn leads to pre-diabetes and type 2 diabetes. So I also made a mention to you that mental health has a very important role to play with gut health. So it's unfortunate that we have some data from the IDF in 2021, which tells us that persons with diabetes have 2 to 3% greater risk of depression and 20% more chance of anxiety when compared to people without diabetes. Last but not the least, they also experience something called diabetic distress. This is all associated with poor gut health, poor blood sugar control, all in as a vicious cycle. And in fact, WHO has a wonderful scale known as the wellness scale. Instead of us taking a scale and measuring the depression or the anxiety scale of an individual with diabetes or without diabetes, WHO has a scale known as the wellness scale, which takes it in a positive note to find out how well the patients are with reference to their mental health. So this is yet another interesting slide which tells us that in 2000 BC, we said, if you are not well, eat a root. In 1000 AD, they said, don't eat a root, have a prayer. Say a small prayer and you will do well. After that, they said, prayer is superstitious, drink snake oil, which is nothing but venom. Then in 1940, they said, no, if you want to do well, if you want to be, if you're sick, you need to improve your health, take a pill. I think COVID-19 taught us that no pill was effective. So in 1985, they said a pill is ineffective, here, take the antibiotic. And in 2000 AD, they came to know a lot of antibiotic resistance because unfortunately, a lot of population pop in antibiotics without prescription, making it resistant to our system. And finally, where do we stand? COVID-19 did teach us that here, eat the root. But obviously, when we eat the root, also there is something called acceptable daily intake with reference to turmeric, with reference to several of the spices and herbs which were consumed during that pandemic. I think more than eating the root, it's like going back to your roots, eating traditional, eating local, eating the traditional fermented recipes, which are even today's date time tested with reference to southern part of our population, the Palayadu, with reference to the North Indian part of the population, which consumes a lot of beetroot kanji. And in Bengal also, they consume the fermented rice, that is the palayad, which we consume in southern part of our country. The role of diet in gut dysbiosis is there is excessive intolerance to excessive fat, saturated fat, refined carbs, commercial fructose, and also the artificial sweeteners, which are consumed by anybody and everybody, which play an important role in altering the gut microbiota. So do we follow an anti-inflammatory diet? Is there any anti-inflammatory diet which will help improve chronic inflammation? I think the answer is we need to go balanced and we need to choose on probiotic, prebiotic, psychobiotic, symbiotic, postbiotics, all from our natural food ingredients. In fact, there was a very interesting read yesterday I think it was India Today, which did make a mention that the answer for obesity and obesity related metabolic conditions, disease conditions, is from our kitchen than in boardroom meetings. So as I mentioned to you, we need to choose on psychobiotics, on Mediterranean diet. Mediterranean diet, I really wonder how, economical it is or viable or practical it is in our Indian scenario to consume 5 to 10 servings of fruits and vegetables. I think basically what we need to do is choose on going on a plant-based diet, taking fiber in all 3 meals of our diet, choosing on naturally fermented foods from our kitchen. Like, for example, the probiotics, so many people get confused. They think every fermented food is a probiotic. Curd is a probiotic. Idli is a probiotic. Dhokla is a probiotic. No, they are not probiotics. Idli batter and dosa batter and dhokla batter and bhatura batter are probiotics because of the live microorganisms or the strains which are available in the range of CFU of 10 to the power of 8 or 10 to the power of 9. But when they are cooked, obviously the probiotic nature of the batter is lost. But what happens that time is when they are cooked, you produce post metabolites or the postbiotics. So the idli, dosa, and the dhokla do provide us biotics, but they are the postbiotics and not the probiotics. Now, when with reference to curd after it is set, it is sour. It is kept outside for about 12 hours. So prepared curd fermented overnight will act like a probiotic. Not fresh curds will not act like a probiotic. This was a paper which was published by the CMC Vellore, I think in 2016, that set curds, when they are kept overnight, they behave nearly like a probiotic. Now, when it comes to prebiotic, the onion, garlic, leeks, then the whole gram, that is the chana, rajma, rongi, barley, oats, all of them are sources of soluble fiber and prebiotics which are available in our kitchens. Synbiotics are combination of these two. For example, in the southern part of our country, they consume a lot of ragi kanji, ragi kali with garlic, onion. Garlic and onion are prebiotics, and ragi, when fermented overnight with the right proportion of curd, it becomes a probiotic. So pro and prebiotic put together is known as a synbiotic. Then the most important probiotic strains, which play a very important role with reference to mental health, depressive disorders, are the Bifidobacterium longum, Lactobacillus helveticus. We have the other diets like the fermented foods, which are considered to improve gut health, like the kimchi, yogurt, kefir. Some of them are made miso, which are soy-based. As I already made a mention to you, the postbiotics and the microbial metabolites. This is a very, very interesting slide, and I'm very, very fond of this slide. I don't miss talking on this slide every time I get an opportunity to make a mention of this. There was a PIL raised in Jodhpur. Jodhpur is known for temples, and temples are known for prasad. Prasad used to be fruits previously, and monkeys are known to jump from one tree to the other tree to consume bananas, which are high in calories. But now the monkeys stopped eating bananas and started sitting on the temple tops, waiting for the devotees to bring prasad, which is jalebi, laddu, kaju ki barfi, and stuff like that. So they found these monkeys to be a menace now in Jodhpur. Not only they found to be a menace to the devotees, but also they started seeing that these monkeys started developing metabolic syndrome. So we need to remember that, how we can worsen our gut health and metabolic health by consuming ultra processed foods which are containing saturated fat, sugar, and sodium. Now, the relationship between gut microbiota and their metabolites in immunotherapy, how do we sort it out? We sort it out, as I mentioned to you, probiotic, prebiotic, fecal microbiota transplant. Now, this topic which I'm talking today is gut health and nutrition. So I don't want to deal with fecal microbiota transplant, but I definitely want to make a mention that fecal microbiota transplant was thought of as early as World War II, where when the German soldiers were having several episodes of diarrhea, they were provided the fecal slurry or the yellow soup, that is the feces, to improve their gut health and thereby diarrheal episodes. So Obviously, today's date, fecal microbiota transplant like feces is provided even in capsules. Now, the 5 R's which we need to remember with reference to improving our gut health or restoring gut eubiosis is remove the triggers. Yeah, I would say in my kitchen, if I am to remove the unhealthy fat, the trans fat, the reheated oil, and the packaged and the processed foods, I am removing the trigger. If I am to replace, I am to replace with natural probiotics and prebiotic. Probiotic are the live strains, which are at the CFU of 8 to 9, 10 to the power of 8 or 10 to the power of 9. And prebiotics in the form of onion, garlic, leeks, whole grams. Also, there are some partially hydrolyzed guar gums which are available in the market, which also behave like prebiotic when you want a therapeutic dose. Then re-inoculate, as I made a mention with you, with all the fructo-oligosaccharides which are present in our natural foods. The prebiotic can come in from the millets which you and me consume. We don't have to take actually, some very, very expensive foods in order to meet our prebiotic requirement in our diet, like the flax seeds, oats, wheat, barley, onion, leeks, garlic. All of them are prebiotics. Now, most importantly, it's not enough if I only take prebiotic and probiotic. I'm also supposed to take some micronutrients like vitamin A, C, E, zinc, selenium, omega-3 fatty acids, which help to repair a leaky gut. Because whenever my gut is dysbiosed, I have a leaky gut, which I made a mention to you. If somebody is in the ICU or having sepsis, actually the leaky gut will worsen the status of sepsis and AKI and multiple organ failure. Otherwise, if I'm not in an ICU, I'm at home, I am healthy but at home, but I simply have gut dysbiosis for several reasons. When I have a leaky gut, I need these micronutrients to repair the leaky gut, and the pre and probiotic will help to improve the inflammation of the gut and thereby achieve rebalance or eubiosis. So remove, replace, re-inoculate, repair, and rebalance. These are the 5 keywords. I don't want to delve into the details of how you can get the probiotics from your kitchen. As I mentioned to you, you have yogurts which are available in the market. You have probiotic supplements which are available in the market. But those probiotics, if they are going to be filled with sugars, which some of them do contain, they are not going to help your gut health at all. Yes, you have the fermented oats which can be consumed overnight with addition of curds overnight. That would be a big source of pre and probiotic, like a symbiotic. I mentioned to you certain of these foods like the kimchi, kefir, tempeh, kombucha, which may not be consumed as much in our culture, but these are sources of probiotics. Now, apart from that, as I mentioned to you in prebiotics, we have the galacto-oligosaccharide, malto-oligosaccharide, xantho-oligosaccharide, which is first to start off with present in human milk. That is why children who are breastfed have gut eubiosis in comparison to those who do not, who are not breastfed for several reasons. These are certain prebiotics which I made a mention to you of. And with reference to millets, as I mentioned, they are prebiotics, but beware, don't buy polished millets, don't buy millet flours. If they do not, if they are devoid of the fiber which we are expecting from the polished millets, if they are devoid of fiber, they may still do contain the prebiotic component, but the indigestible fiber component, that is the insoluble fiber, may be lost in polished millet flours. And with reference to millet, always remember to either sprout them or roast them prior to consumption, or ferment them to prevent the goitrogenic effect of millets. Now, this is our Anjara dabba, or the dabba in my kitchen, from where I can get 6.5 grams of soluble fiber per day. So if I'm going to choose apple or guava, add oats, overnight oats, or wheat flour, or have idli dosa, wherein I'm using the black gram dal. I'm using curry leaves in my preparations. Fenugreek seeds have the soluble fiber, the gingerly seeds, the green grams, and the vegetable C exchange, especially the lady's finger, broad beans, and the guar fali or the guar gum, or in Tamil, they call it as kottavaranga. These seeds, these form of beans have a source of soluble fiber, which you can add to your diet. Now, this is yet another entity which I can talk over an hour, so I will just make a mention. resistant starches also behave like prebiotics. But obviously, the ones which are available in our kitchen are the whole or the partially milled grains, seeds, and legumes. I would not go into the details of RS3, 4, and 5. So prebiotics play a direct as well as an indirect role in glycemic control with the help of action on, PYY and GLP-1, short chain fatty acids, also help in improving the absorption of calcium, magnesium, improving insulin resistance by reducing inflammation. So this is yet another wonderful image of how gut and fiber have an important role to play, from improving colonic health to gut eubiosis to reducing cholesterol, immunity, reducing blood glucose, as well as improving weight. So how does the dietary fiber work? It works both at the colonic, hormonal, and intrinsic level in order to improve metabolic health. So an important thing which we need to remember is the indigestible fiber is converted to short chain fatty acids, which in turn have this effect on PYY and GLP-1. And also, not only that, they also reduce the risk of coronary heart disease, type 2 diabetes, colorectal cancer, blood pressure, risk of diabetes development. Also, we remember that soluble fiber in the form of a prebiotic have a second meal effect when we consume barley, oats in our breakfast. You will find that it also has a important second meal effect. It has a role to play on the postprandial glycemic control in the second meal, that is the lunch. So similarly, if you take it for lunch over dinner, when take it for dinner over breakfast, also yet another study which tells us that when we improve our gut health by consuming a plenty of fiber, we can prevent the progression of CKD, and the incidence or prevalence of CKD comes down with the help of these important studies known as the pre-DIME study, Japanese Fukuoka study, the Carvalho meta-analysis. Also, there is some role to play with reference to CVD, type 2 diabetes, colorectal cancer, and the risk of mortality. So with reference to IBS, also IBS, sepsis, dumping syndrome, H1N1, constipation, antibiotic associated diarrhea, we need to remember to improve our gut health. So IBS C or D, they are two different entities. What you can do for diarrhea, you cannot treat constipation separately. Constipation has to be sorted out with plenty of fluid, insoluble fiber, and physical activity, whereas diarrhea has to be sorted with soluble fiber, plenty of fluids, lot of probiotics. So basically, probiotic and prebiotic will help in IBS-D. Whether it's with IBS-C, it cannot be the soluble fiber. It has to be the insoluble fiber. Now, inflammatory bowel disease is yet another 2-hour project, which I may not be able to discuss now, but I would definitely want to make a mention that I had done a small study in Westar rats, wherein I had induced ulcerative colitis, that is inflammatory bowel disease, one segment of IBD in Westar rats, experimental rats, and fed them with the fermented rice palayadu and partially hydrolyzed guargum, that is a prebiotic. And we did histopathology by euthanasia of the rats after the study was completed. And we found that the rats who were put on the palayadu, that is the fermented rice, there was complete remission of ulcerative colitis. In fact, there is a major study going on with 3,500 subjects in Stanley Medical College in Chennai, where they found a lot of benefit with the fermented rice, which is the probiotic, which helps in improving ulcerative colitis or colonic inflammation. So one-stop solution is improve your gut health. So medical nutrition therapies take 28 grams of fiber per day. Take it from your kitchen, which will help your gut health, reduce oxidative stress, improve or heal the gut, prevent the leaky gut, build up immunity. And finally, all this rests on microbiota balance. Every day we live and every meal we eat, we influence the great microbial organ inside us. For better or for worse, you are what you eat. Oh God, give me food, does not give me disease, but also gives me strength. Thank you so much for your patient listening. I'll be here for questions.
Thank you so much, ma'am. Audience, participants, you can just put your questions on the chat box, or you can unmute yourself and ask your questions. Ma'am, you were mentioning about the monkey study in Jodhpur, no?
Yeah, ma'am.
And you like, whenever you get free, please share that with us.
No, it's not a study. It is a PIL. It is a litigation which was put by people in Jodhpur, in and around the Jodhpur temples, where they found these monkeys jumping to the temple tops and to irritate the devotees who were coming to snatch the laddus and the jalebis. So they had put the PIL saying the devotees hereafter should not carry laddus and jalebis. They should carry only fruit salad so that these monkeys don't be a menace. And ultimately, unfortunately, the monkeys became so overweight and obese that they were found to have metabolic syndrome.
Someone has posted, what about milk in this?
See, milk, as I mentioned to you, breast milk is a wonderful source of prebiotic. It's a wonderful source of prebiotic. So one should consider breast milk like that. And when you want to talk of gut eubiosis, I would say go for low fat milk or skimmed milk. So you don't need to go and buy skimmed milk. You can buy milk, boil it overnight, and boil it, keep it overnight in the refrigerator, remove the layer of fat so that you are away from saturated fat and trans fats. Otherwise, milk is good to go. But milk may add on to trouble for those who are having IBS-D, that is inflammatory bowel disease, inflammatory bowel syndrome with diarrhea. But as I mentioned to you, if the IBS is associated with anxiety and depression, in fact, I know so many patients after the interview, after the exam, after the stressful event, they come back and eat a biryani also, they are doing very well. So I think we need to work on the improving mental health. So when you improve mental health, IBS-D definitely improves. Obviously, you have to work on your diet also. It goes without saying.
Could you please explain how the ragi can be fermented? Is it like parananji?
Yeah, see, I do not know what is palaya kanji in your language, but what in Chennai we do, or in Tamil Nadu, what we do is rice, 2 teaspoons of rice. See, you can actually have a pot of cooked rice. But what do I do tell my patients is just take 2 spoons of cooked rice, fermented overnight. If you can put it in a mud pot, good to go. If you cannot put it in a mud pot, in a small tumbler, morning you add 1 teaspoon of curd, a pinch of salt, and mix it with your hand. Blend it with your hand and drink the liquid portion. You can have the rice also. It's the liquid portion which is consisting of the probiotics. So sprouted ragi is fermented overnight and they add buttermilk to it and have it with onion, garlic, as well as karamani, that is the legumes, rongi, which we call it otherwise. So that is a pre and probiotic combination which helps to improve gut health. There is a question on Crohn's colitis. That is a 1-hour lecture by itself. So probably sometime later on, I can discuss on Crohn's and colitis separately. But if you want me to give you a broad outline with reference to Crohn's, we usually go with a low residue diet because and low residue, lactose-free, MCT-based, small and frequent. Depending on tolerance, we will increase the quantity of the food the patient is consuming. And there is a lot of malabsorption with reference to Crohn's. And you will see malnutrition due to malabsorption. So they have to be put on a semi-elemental formula in order to improve energy and weight gain. With reference to colitis, it's usually plenty of fluids, lot of sodium, lot of potassium, lot of curd, lot of palayadu, and partially hydrolyzed guargum. And we keep them off insoluble fiber. So that's the difference between Crohn's and colitis. And there's a lot of talk on wheat and milk-free diet for cancer. No, I wouldn't go with that because our hospital where I'm working currently, it's about 80% of the population is cancer. So we don't go gluten-free or lactose-free for our patients unless and until they have, like, say, for example, if I've had a patient with CA colon, where the patient is having more than 7 or 12 episodes of diarrhea, or if my patient has had a colostomy bag where I need to worry about the ostomy foods, wherein I would restrict the wheat and the lactose, or my patient has had CA pancreas, where the patient has had a Whipple's procedure, where I would not want to push my patient on wheat and lactose, that's when I will think of it, not otherwise. So probiotics can be given to a transplant patient. I think we need to have some reference for it. There's inadequate reference to say that, recommendation more than a reference. I would say there is no recommendation or a guideline to say to provide probiotics. for our patients. It can come from our day-to-day diet. A pregnant lady with IBS who's liking to take only spicy and fried foods due to hyperemesis, what is your recommendation? Let her take what she can tolerate and add a lot of buttermilk in order to improve her IBS. So if in an IBS patient, if she's going to take spicy and fried snacks, I think it's going to worsen her IBS. So that has to be considered in your patient specific condition. And diarrhea and critically ill, yes. In diarrhea and critically ill, I use a lot of partially hydrolyzed guar gum in my patients, and it does wonders for these patients, whether it's antibiotic associated diarrhea, enteral feed, or chemo patients. Currently, we are doing a study. One of my PhD scholars is doing a study with those patients who are having dumping syndrome, as well as those patients who are having CA colon. So we have found that even if they are on chemotherapy or radiation therapy, the number of episodes of diarrhea are improving with partially hydrolyzed guar gum as well as with palayadu. But in critically ill, I cannot use palayadu. In critically ill, I only use, partially hydrolyzed guar gum. Yeah, I made a mention of second meal effect. That is when foods are containing soluble fiber. Say my PhD was on barley-based idli and barley-based dosa. Barley is a prebiotic soluble fiber. So when I fed my patient barley-based idli or dosa, it had an influence of satiety up to the next meal also. So even some of the patients improved satiety even up to breakfast. So that is known as second meal effect when you consume a lot of soluble fiber. Not only comes from barley, oats, chana, rajma, all the whole grams. Partially hydrolyzed guar gum is a specific fiber which is available in the market, which I use in my hospital setup in critically ill, as well as in those who are hospitalized. I cannot use palaya kanji in critically ill patients, right? So that's when I have to look at partially hydrolyzed guar gum. I don't have any first-hand experience on dried turkey berry powder in IBSD. I'm sorry.
Basically, in Tamil Nadu, there is a belief, no, turkey berry powdered, dried turkey berry powdered will help in Siddha and all they used to give.
No,
So
I'm sorry. I have no first-hand experience of it.
Okay. I think there is no much questions, ma'am. So, anybody else want to share any of your views?
Yeah, so there is a question like probiotic is lost. That's what if I think if you would have heard my presentation, I did make a mention that idli, dosa, batter are probiotics. When they are cooked, they lose their probiotic activity, but then they have something called postbiotic. That is the microbial metabolites are available in the idli and the dosa, cooked idli and dosa, which also have, their impact on gut health. They don't act like probiotics, but they are microbial metabolites which also have an impact on gut health.
So one last question, ma'am. Share your
Yes, ma'am.
views on this ice cream.
I would never say have a probiotic ice cream. Any common sense in that? It's like, you're going to load your ice cream with unhealthy fat, that is saturated fat, trans fat, a lot of sugar, refined carbohydrate, if required, to some stabilizers, some food additives, which is definitely not going to do any good to your gut health. So it's just a marketing gimmick. I don't think as nutritionists we should fall prey to it. So we need to do clean eating, that is go low in saturated fat, high in fiber, both complex in the form of soluble and insoluble fiber, to get the benefit of short chain fatty acids as well as microbial metabolites.
Thank you so much, ma'am. There is, I think, one more question on partially hydrolyzed guar gum used for.
Yeah, we use partially hydrolyzed guar gum in our feeds. And in fact, there is some data to tell us that we can use partially hydrolyzed guar gum pre and probiotic in critically ill patients, which does improve the leaky gut. So there is some recommendation from Aspen, a very early recommendation.
Thank you so much for accepting our invite and joining us today. And like almost everyone was, when the session invite was posted everywhere, everyone was tense because it was a Easter day. Actually, while we are fixing, I think we fixed this 2 months back, right, ma'am? So
Yeah.
I was totally having no idea. Just like every week, there is this program goes on in the third week of every month. So I fixed with that date. So thankfully, like we have a good number of participants, more than 40 participants were there in the session. And it was very interesting and absolutely informative session for many. And most of them also had mentioned in the chat box that it was a very useful session. Thank you so much for the wonderful presentation and very interesting PowerPoint slides, beautiful designs, and small witty slides also. So very thankful for this session. And apart from this, I am also thanking this participants irrespective of the Sunday evening and vacation time and all those things. You have taken time to have join us for this meeting. Like I remember some of the doctors, even Dr. Mohan had mentioned this is the only platform, CNF is the only platform where we have many number of people join for the webinars. It is outdated now in doctors community, but as usual, we are getting many good number of, I was also worried about the vacation time. Still, we had a good number of participants. Thank you, dear participants, all of you for joining us. And very thankful for the CNF members, executive and board members, and our president, Sharon Chechi, for this wonderful supportive event. And we wish you all a very happy vacation time and wonderful event and wonderful year ahead. And see you again. We have a wonderful journal presentation this month, and that is last Friday, April 25th. Find time to join us on 25th April, 7 to 8 p.m. And again, next Dietopedia session will be next month, May 3rd, Sunday. Thank you all. Have a good day.
Thank you so much, ma'am.
Thank you.